preparation is concerned, you will be required to calculate quantities of ingredients according to a formula, to prepare an extemporaneous formulation, as well as reconciliation calculations in your repackaging operations. Some recommended textbooks that you can use to practice your calculations ahead of time. There's a textbook called Pharmaceutical Calculations. The author is H.C. Ansel. You can see there's a picture of the cover of the textbook. Calculations for Pharmaceutical Practice, A.J. Winfield. And then Pharmaceutical Practice, also by A.J. Winfield. And as we said, the textbooks are of more value before the exam than during the exam, because you have to be mindful of time in the exam. You can't be sitting scrolling through a textbook in an exam hoping that an answer will jump out at you. Remember, there's only a limited number of questions that are knowledge questions. The other questions are application, and then even higher level, your evaluation questions. So you're not going to find a straightforward answer for those questions in a textbook. You need to prepare ahead of time. And then not all calculation types in these textbooks might be applicable. So you need to understand what is within your scope of practice as a basic assistant, and then you can use your course notes just to guide you in terms of the types of questions that are required by a basic assistant. And then within those textbooks, you can go and look for examples to practice that are that type of question. Right, so some other calculation tips and advice. It's important to understand the principle. Don't try and memorize the calculation, because if you try and memorize the calculation, that's knowledge, but calculation questions change all the time. So you need to be able to apply your knowledge. You need to understand what an SI unit is. This is a very important one, and that students often get incorrect. Okay, so if you're not going to remember this, that when you see a percentage weight per volume, you need to, in your mind, be able to know what does that mean. Whenever you see a W over V, it is grams per milliliter. So often in a calculation that includes percentage weight per volume, there may be an associated conversion that needs to take place, because perhaps you are told to give an answer in milligrams. And so you do your whole calculation and you get your whole calculation correct, but it's grams per 100 mole. But the answer or the question is asking you for how many milligrams. So you give your answer thinking it's correct, and you have calculated it correctly, and you give it as 10 grams. But the question asked for the answer in milligrams. Okay, you give your answer as 10, but at the back of your mind you've forgotten that weight per volume is in grams, so then you have to do another calculation to calculate or to convert the 10 that you got into milligrams. Okay. You may bring a calculator into the exam, but a tip again, don't bring a different calculator into the exam than the one that you've been practicing with. Whatever calculator you've been practicing with, make sure you bring that same calculator into the exam with you. Check that the batteries are working, that they're not going to die on you in the middle of your exam, because you're trying to reduce stress and anxiety. Okay, so part of your preparation, make sure that the batteries of your calculator are not going to go flat. Make sure you know the settings of your calculator, and then always bring in additional pen and paper so that you can work out your calculation on the piece of paper next to you. Okay, write it down, do the calculation, see what you've done. Have you done it correctly before you attempt to answer the question? Keep in mind, you have to pass your calculation section independently. Okay, so that means that even if you get 100% for your general section and you get 20% for your calculation section, you're going to fail the exam because you didn't pass the calculation section on its own. Right. More tips. As you go through your calculations, think about the question, think about which formula is the correct formula to use. This is an example of when you might want to then go and refer to your notes in your open book because you've got a reference. So you could say, okay, this is asking for average monthly consumption. This is what I remember average monthly consumption being, but I can't remember if I must include my out-of-stock month or mustn't. Let me go quickly and check in my textbook on stock management what the formula is for that calculation. And then you know exactly where to go, and it shouldn't take you more than a minute to go and find it. Yes, I confirm this is what I must include, this is what I mustn't include. Okay, so select your correct formula. Transcribing, this is one of those points where you really have to pay attention to detail. You're reading your question on a screen because it's an online assessment, but then you write down the numbers onto the page that you're going to do your calculation on because you brought pen and paper with, right? So you write down the calculation on there was a 3 on the screen, it was 300 on the screen, and when you wrote it down, your handwriting is so bad, it looks like a 500. So you do your whole calculation based on the 500 that you wrote down, but the question actually had a 300 in it. And that's what we mean by transcribing problems or errors. Double check that what is on the screen in the question is the same as what you've written down, and then you start doing your calculation on the paper to get your answer. So double check against the question that you've used the correct figures in your formula. Okay, that's transcribing, copying what is on the screen onto the piece of paper where you're doing your calculation. This is also a skill that you need to develop. When you read a question, you should be able to, by the end of reading the question, think, I think that the answer is going to be approximately 5 or 10 or whatever it's going to be. I think that the answer for this question is going to be approximately 5. Then you calculate it and you see that your answer is 500. Then you should be asking yourself the question, hang on a second, when I read the question, I estimated the answer to be 5. Now I've done the calculation and I'm getting 500. Maybe there's an error somewhere. Okay, so that's what we mean by, if possible, try and estimate a range for your answer. And if you then do the calculation and get a completely different answer, that should give you an idea that you've made a mistake somewhere, and that you should try again and redo the calculation. And then double check your calculations as well. There's plenty of time to double check your calculations. Okay. Right, so this, why are conversions so difficult to get right? Okay, so we thought that we should show you or use this as a reference source even when you're doing conversions, when you are converting between units. Just now we were talking about mass per volume and we said that that is grams per mil. So let's say I have 5 grams and I said that we want the answer in milligrams. So you came to the conclusion that your answer was 5 grams. You calculated it. You got to the answer as 5. Because mass per volume is in grams, the 5 is 5 grams. But the question asked for the answer in milligrams. So now the next step of your calculation is to go from grams. I have to convert it to milligrams. So if I had 5 grams in my answer, in your calculation, but the question is asking for the answer in milligrams. I must then do what? I must multiply by 1,000. So 5 times 1,000, that means in milligrams my answer is going to be 5,000 milligrams. We also always have an issue with changing from milligrams to grams or grams to kilograms. And students don't know how many decimal places they must include in their conversion. So if I have 5 milligrams, now I've changed it, now let's use another one. Let's say 8 milligrams. 8 milligrams, and I need to get to grams. Must I multiply? No, because I'm going opposite to the arrow here. I must divide. The number needs to get smaller because there are 1,000 milligrams in 1 gram. So if I've only got 8 milligrams, then I've got a lot less grams. And that will take me into a decimal of 0.008. Because I've had to divide 8 milligrams by 1,000 to work out how many grams I have. And the same goes for grams to kilograms. If I've got 0.008 grams, that's very few grams, and now I want to convert to kilograms, is my number going to get bigger or smaller? It's going to get smaller because I'm dividing now by another 1,000. So where are my zeros going? They're going after the decimal place, not in front of the decimal. So now I've got 0.00008 kilograms. Okay, so the most important thing is that you have to be able to understand when must I multiply and when must I divide. And then where must my decimal place go? Okay. How do I move my decimal place and how many zeros or how many places down do I need to move it? And if you've been taught well, it's about the number of zeros. So from your number, you move it 3 places because you've divided by 1,000. Okay, right. I hope I haven't confused you. I hope I've helped you rather than confused you. The next one is also just looking at conversions, but as far as liquids are concerned, again, liters and kiloliters are bigger than milliliters. And so if you're going from a smaller volume to a larger volume conversion, then you are dividing. And if you're going from a larger to a smaller, then you are multiplying. Okay, so print these out, use these as a reference guide so that when you need to do a conversion, you've got it with you to do. Okay, managing time, we said that you need to maximize your time. So for your 16 multiple choice questions for your calculation, you will have approximately 42 minutes, and that gives you just over 2.5 minutes per question. And that should be more than enough time. You will do some questions quicker than other questions, so maybe you'll have a little bit more time for your more difficult questions. But it's approximately just over 2.5 minutes per question. And then, again, reiterating that we don't see negative marking, so don't leave anything blank. Right, so now it's up to you to do some work. Here is a link. You can scan the QR code if your phone can do that. Or we'll put the link into the comments. If I can just ask the office, if someone can just copy and paste the link into the chat, then the learners can just copy it from there and access the link from there. There are 10 calculation questions for you to attempt now. I'm going to give you 10 minutes. Okay, so that will bring us and then we will go through each of the calculation questions and see how you've. Okay, I think the link has been copied into the chat, so you can access it in the chat. Right, there's 1 minute remaining. We've got about 170 responses, but 500 attendees. So I'll give you another minute or two. Okay, let's start looking at the responses. So question 1 was a simple conversion. And so I can see that most of you have multiplied the 5 by 1,000 to get to 5,000 milligrams, which is correct. Some of you have then struggled and you've divided. Remember, we're going from a large unit to a smaller unit. So 5 grams is less than, in terms of a number, than milligrams. Milligrams has to be a lot more. There's 1,000 milligrams in 1 gram. And so to convert 5 grams to milligrams, we need to multiply by 1,000. What I will try and do is just paste an explanation into the chat box for you. And this one is probably the simplest, which is 5 grams times 1,000 to get to milligrams. Right, the next question is how many medicine measures is 30 mils of cough medicine? Can't see the whole question. Is 30 mils of cough syrup? Okay, so the important thing here is to know how many mils is a medicine measure. We don't talk about, when you type a label out or write a label out for a patient, you don't say to the patient, take a teaspoon, take 1 teaspoon. We talk about take 1. And so this is a foundational concept that you should know, and that a medicine measure is the equivalent of 5 milliliters. Okay? So 5 milliliters, then how many medicine measures is 30 mils? We take 30 mils of cough syrup and we divide that by 5, and so the answer will be 6. Okay, here's one of our tricky ones. What does 25% mass per volume mean? Whenever we have a percent mass per volume, it is always grams per mils. Okay, that's just something you've got to learn, something that you've got to know. And so this is a straightforward knowledge question with a very little bit of application because we put a 25. in front of the percent, and so the application here is that it's 25 grams per 100 ml. It's never milligrams. It's always exactly as it's stated, 25 grams per 100 milliliters. And I think what causes the confusion here is because we sometimes think of grams, the equivalent in when we talk about liquid, we might talk about, grams and liters. I don't know what causes the confusion, and that milligrams and milliliters goes together. But in this case, it is always grams per milliliters. Okay, you just have to learn it and know it and remember it. Don't try and convert. You don't need to convert in this case. Some people have said it's 250 grams per 100 ml. No. Okay, it's 25 grams per 100 ml. That's what it means. Now, in another question, you might have to apply that even further. Okay. Okay, this is just calculating a percentage. What is 50% of 16? Most of you have got this correct. 92% of you have got this correct. To find the percentage of a number and convert it to a decimal. Okay, so how would you approach this? 50%. What does 50% mean as a fraction? 50%, if I have to rewrite that as a fraction, I would write it 50 over 100. Because remember that a percentage is always out of 100. Even though people talk about, oh, I love you 200%, or I support you 1,000,000%. There's no such thing as 1,000,000% or 200%. There's only one kind of percent, and that's 100%, and anything less than 100. Because it's 100% of a circle. Okay? 100% of a circle is one circle. You can't make the circle different. You can make the circle wider or smaller, but it's still going to be 100%. So, when we talk about percentage, it's only ever 100. And so if I change a 50% into a fraction, I'm going to indicate it as 50 divided by 100, or 50 line, and then under the line, the 100. And that is going to then give you a decimal, and the decimal will be 0.5. Okay? And so then to work out what is 50% of 16, I'm going to take my decimal, which is 0.5, multiply it by 16, and you will end up with an answer of 8. So that's a fairly simple conversion, and because I said you had 16 questions in your in your calculation section, and 50% of those are from ELO 4, you already knew that answer. But as far as the calculation is concerned, you can first convert to a fraction, then to a decimal, and then multiply it by 16. If you did it a different way, that's also fine. I'm just giving you one way that you can do it. Right, now we're starting to get into questions that are maybe a little bit more detailed. So this question is, a person weighed 70 kilograms at his previous doctor's visit. At his current visit, the patient lost 5% of his weight. How many kilograms has the patient lost? Okay, so now what you've got to do is start off by calculating what is 5% of 70. Okay, because they weighed 70 and now they've lost 5% of that 70. So to calculate that, what do? Convert your 5% into a decimal. So 5 divided by 100 is going to give you 0.05. You then multiply 0.05 times 70, and that's going to then give you 3.5 kilograms. And so how many kilograms has a patient lost? Well, you have to work out 5% of 70, and that gave you 3.5 kilograms. Okay, now. Milliliters of water, and you're adding 20 milliliters of alcohol. It doesn't stay at 40. It goes up to 60. Okay? So 60 moles is your total solution. How much alcohol is in that total solution? There's 20 moles of alcohol. So if I have to show that as a ratio, the ratio is going to be 20, and then we have the colon. As you can see, these little ratios here. Okay, that little colon, so you'll have 20, and then the colon, and then the total solution, which is 60, right? So 20 colon 60. Now simplify that. If you simplify that, you're going to get 1:3. And I know I'm going to get questions afterwards to explain this again. So be careful, think about it carefully. I'm not asking what is your ratio of alcohol to water. The ratio of alcohol to water is 20 to 40. 20 colon 40, yes, I simplify that, I'm going to get 1:2. That is the ratio of alcohol to water. That's not what the question is asking. The question is asking, what is the ratio of alcohol to total solution? Total solution, I must first add 20 plus 40, I get 60. Now, what is the ratio of alcohol? Well, I've got 20 moles of alcohol in my solution. 20 colon 60, simplified, I'm going to get 1:3. So those 28% of me, they've got 1:3. That is the correct answer. Okay. I'm just leaving it there for a second for those of you that got it wrong to think about it again. Okay, next question. This one is also, it's a little tricky. I think it's just about being able to calculate again. During the packaging of a batch of medicine, 1,980 labels are used from 2,000 that were originally issued. What percentage of labels must be returned to the dispensary? So this is a calculation question, that is a reconciliation question. Okay, in manufacturing pharmacy, the dispensary in the manufacturer issues both the packaging materials as well as other materials, raw materials, etc. So, during the packaging of a batch of medicine, 1980 labels are used, but 2,000 were originally issued. So what percentage of labels must be returned? So it starts off quite easy. I started with 2,000 labels. I used 1,980. That means I've got 20 labels remaining. Okay, do you all agree with me? Got 20 labels remaining. I have to return those. I can't throw them in the bin. In a manufacturing facility, it has to be reconciled. Okay, so I must now account for those labels and I must return them to the dispensary. The question is not asking how many labels must be returned. The question is asking what percentage. So many of you said 20. Well, yes, that's how many labels must be returned. But the question says what percentage of labels. So there is a double calculation here. First, you're calculating how many labels I must return. I must return 20 labels. But what is the percentage of labels that must be returned? You calculate that using the number of labels that were originally issued. So if 2,000 labels were originally issued, I'm going to say 20, because that is how many labels I've got left over, divided by 2,000, and then to get a percentage, I must then multiply by 100. So first you're going to say 20 divided by 2,000, you're going to end up with 0.01, and then I must multiply that by 100 to get a percent. And if I say 0.01 times 100, you're going to end up with 1%. So you are returning 1% of labels to the dispensary. Okay, so this next question is also maybe a slightly higher order level question in that yes, you need to have a knowledge base and then you need to apply, but then you have to evaluate all of the information that you've been given to be able to get an answer. Okay. So it says 50 containers of medicine are counted during a cycle count. Of the 50 containers, 5 are expired, 2 are short dated, and 3 are damaged. Using the information given, how many containers of medicine can still be issued? Now, if you're working at a wholesale pharmacy and you need to put an order together, depending on your facility's policies, this question might cause a little bit of confusion, and we try not to set questions that are ambiguous or that could produce different answers depending on the facility that you're working on. We try and stick to what the legislation says and what the face value of the question is. And this is an example where you have to look at the face value of the question. Okay? You had 50 containers. 5 have expired. Can we use 5? Can we use expired stock? We definitely can't issue expired stock. Okay? We know we can't issue expired stock. Can we issue damaged stock? No, we can't issue damaged stock. But short-dated stock, there's no rule that says you can't issue. There's no legislation that says you can't issue short-dated stock. Okay, provided the patient can take the medicine within the month that it's issued, within the month that it's going to expire. So if it's expiring at the end of the month and they'll be finished it by the date of the expiry, then we can issue it. And so the 2 short-dated containers are still usable. And therefore, the unusable containers are the 5 expired and the 3 damaged. And 5 plus 3 is 8. And so 50 minus 8, that means that we have 42 containers of medicine that can still be issued. Okay, so that maybe just explains why some people have said 40, because you've also added your short-dated stock. But just think about it at face value. Can short-dated stock still be used? It is still usable. And with the information that has been given here, the short-dated stock can still be used. Maybe if the scenario was a little bit more complex and the patient, it went on about the patient's been issued with 3 months of treatment, but the short-dated stock is expiring at the end of the first month, then that would be a little bit more complex and require a little bit more detailed thinking as to can this be used or can't this be used. But from the information you've been given here, as far as you are concerned, this short-dated stock is still fine to use. It hasn't yet expired and it's not damaged. Okay, next question. I am still here. Sorry, I'm just struggling with my other screen. Well, so just trying to see the whole question. So what is the total value of 15 containers of medicine that has a cost per unit of 130? So if you go back to your ELOs, one of the competencies was that you need to be able to calculate the value of medicine. The cost per unit is 130, so you would just multiply your 130 by 15 containers multiplied by 130 to get your answer. Right, and then the last question. Some of you said 866. I'm not sure. You must have divided 130 by 15. Trying to work out why you would have done that. If we had included a container of medicine contains 100 tablets, what is the cost of each tablet in a container? Perhaps you were thinking along those lines, but you've only been given 15 containers, and that each container costs 130 units. So it's a simple 130 times 15. So another tricky question. How many tubes of a 20-gram cream are required to be added to 80 grams of aqueous cream to make a 20% mass per mass compounded cream? Right, so we've been talking a lot about mass per volume, but let's talk about mass per mass. Mass per mass is grams per grams, not milligrams per milligrams, grams per grams. Okay, so this one I didn't ask any additional conversions. You've been given a tube of 20-gram cream to be added to 80 grams of aqueous cream. And you see this mass per mass. So that means you've got grams of cream, grams of aqueous cream, and your compounded cream is grams per grams. No conversions need to be done. Okay? We had asked a question and said 20 milligrams of cream are required to be added to 80 grams of aqueous cream. Then it becomes more difficult because first you must convert your milligrams to grams. Okay, so this question does not require any conversions between grams and milligrams. You've got 20 grams of cream, you're adding that to 80 grams of aqueous cream. How much are you going to have in the end? What's your total volume of cream going to be? If I'm adding 20 to 80, I'm going to get 100. Okay, so your target concentration is 20% grams per grams, meaning 20 grams of active cream per 100 grams of total compounded cream. The active ingredient is 20 grams. And your total mass will be 20 grams plus 80 grams, giving you 100 grams for your compounded cream. We've already established that your active ingredient is 20 grams. And you need a 20% mass per mass. So 20% mass per mass says I need 20 grams per 100 grams. And now you know that you've got a 20-gram cream, and once you've made up your compounded cream, you're going to have 100 grams. So that means that you only need one tube. You need 20 grams of the 20-gram active ingredient cream, and one tube of that is 20 grams. And so the answer here is 1. Right, so that brings us to having a quick break. I think the office said it's a 10-minute break, if I'm not mistaken. So we will see you in 10 minutes. and that will be at 25 to 11. So you can put your questions into the Q&A if you've got any questions on those calculation questions, and I will try and paste some explanations in if you need. overrun. I think we just gone 25G. I'm going to give a minute or so for people to get back in front of their computers. I do see that there are some questions in the Q&A asking for more examples on question 10. I'm going to finish presenting my section, and while the office is busy with their section, I will develop a new question and post it on the Q&A with an explanation as well. So I'll post an explanation for question 10, and I will post another example that is maybe a little bit more difficult on that as well. Right, so now we are at the general questions. There are a lot more general questions in the exam. They are also divided into the 4 ELOs. We've already said what each of the ELOs are. So we'll just look at some examples of types of questions that might be asked from each of those ELOs. 42% of the questions, as you can see, the bulk of your paper is coming from ELO 1, which is basic foundational principles. Okay? And then 26% of those questions will come from ELO 2, which is your stock section, 18% from manufacturing, and 14% from compound. Reference materials again, you're permitted to use books, PDFs, copies of downloaded or printed materials, as well as the online references. And as I've mentioned, and the office will explain to you, you can also access some references directly on the exam platform. Reminding you that you are writing an exam about South Africa. So some of you might think that AI is a good option to go and look something up, but it's not going to give you the South African context, and then you will get your question wrong. So I think the office can also explain, I think some websites will be blocked as well. Here is the references that you may use. Again, recommended that you familiarize yourself with these before the exam. The essential medicines list and standard treatment guidelines, all 3 versions, the primary care, pediatric, and hospital versions, and make sure that you are using the most current versions. The most current versions are available on the Knowledge Hub website. Perhaps again, if I remember, let me quickly make a note. I will post a link to the Knowledge Hub in the chat box when I have an opportunity to see more. Okay, just like that. The Good Pharmacy Practice Manual and associated rules, that is available on Pharmacy Council's website, and we will go through that in the next few slides. Then the South African Guide to Good Manufacturing Practice, that is also available on the SAPRA website. The Pharmacy Act is available on the Pharmacy Council website, and then the Medicines and Related Substances Act is available on the SAPRA website as well. The important thing is that it's not just the acts themselves, but it's the associated regulations. And then as far as Pharmacy Council is concerned, it's all the board notices as well that are applicable, and changes and updates that have happened to GPP. Just recently, there was an update to GPP that was published around what reference sources are necessary to be kept in pharmacy. So the legislation, particularly board notices relevant to GPP, are being updated all of the time. So it's important to keep track of those. Right, so this is how you can access electronic resources on Pharmacy Council's website. It doesn't have an exhaustive list. It doesn't have the Medicines Act, for example. Everything related to pharmacy, the Pharmacy Act, the regulations applicable to the Pharmacy Act, the board notices, guidelines and rules that are governed by Pharmacy Council are available on this website. Okay, so you may still need to go to SAPRA's website to get the GMP and the Medicines Act and regulations. Okay, so just on the public site of Pharmacy Council, so the www.pharmcouncil link website, this comes up, as it is, comes up. And here where you see this little book in the middle, icon. You don't even have to log in to your profile to access this. It's right on the front page. So you can click on the little book, and then these next icons will appear. Okay, so the little book in the top right corner of your screen, you click on that, and then legislation pharmacia comes up under publications. Then you can click on legislation, and legislation will take you to the act, the regulations, the rules, the proposed legislation. The pharmacia is the Pharmacy Council publication that comes out every year, which is another reference source that you could access, although the pharmacia is maybe not as specific, because it's issues that are with latest information or information of interest at the time that is published. So if we go to the next screen, it comes up. You'll see if you click on legislation, it will come up: acts, regulations, rules, board notices, proposed legislation. Well, what are you going to find under Act? If you click under Act, hopefully you will find the Pharmacy Act. Under the regulations, you will find all of the regulations that are relevant to the practice of pharmacy and the pharmacy profession. Okay, that are active. In other words, they are in use, even if some of them are very old. Okay. Remember earlier today I spoke about the fact that last year there were new regulations that were published, updated regulations. So for example, here, Practice of Pharmacy 2000, those are the practice regulations from when they were published in 2000, which are still relevant, except that there were changes and amendments made in 2024, regulations into the Practice of Pharmacy amendments. So you have to consider, okay? But in particular, the most updated information is in the amendments. The same with the registration regulations. Those were also amended last year, as well as pharmacy education and training was amended in 2024. Okay, so it's important. Those are the regulations that are linked to the Act. And then there's also the rules. And in the rules, this is where you will find your GDP, Code of Conduct, and ethical rules. Ethical rules, acts for omissions, which can lead to disciplinary action, Good Pharmacy Practice Manual and associated rules, except that although this Good Pharmacy Practice Manual is the consolidated Good Pharmacy Practice Manual, there are updates all of the time. All of these updates, have not necessarily been integrated into this Good Pharmacy Practice Manual. And so it's important that you know what these are and what the changes have been over the last few years, applicable, again, to your scope of practice. And then our Code of Conduct is also, you can also get that on website. More board notices also. Some of them are linked to fees that are payable, guidance documents, that kind of thing. Again, think about what's relevant to your scope of practice. Don't feel like you've got to go and learn all of this. For example, Good Pharmacy Education Standards for higher education. That's not relevant to you as a basic assistant, so you don't have to go and read that board notice. And it's important for you, go back to your notes from your provider, look at what you did cover in terms of the legislation, then come here to this site and pick out the most updated that are aligned with what you needed to learn as a basic assistant. These are proposed legislation which is still out for comment. In other words, it hasn't yet been implemented. So we are interested in only legislation that has been implemented. Okay, I've already spoken to you about how to use your reference materials that you prepare beforehand, and only use your reference materials to check an answer. Make sure you know what is in your reference material, read your question, interpret your question. If you read your question, you say, okay, this question is about what I need to be able to register as a basic assistant with Pharmacy Council. That is linked to the registration regulations. Okay, I'm not quite sure about this. Let me quickly go and check the registration regulations for basic assistance. And that can help you there answer the question. But don't think, oh, now I need to go and look for information about registration. And then you start paging through all the textbooks and all the documents you brought with you, because then you're going to waste 20 minutes just paging through everything for one question. Okay, you have to go in prepared. You have to go in knowing what information you've brought in with you, which books you can, or which books or reference sources to use for a particular question, and how to use that source. Does it have an index? Does it have a table of contents? Have I highlighted the sections that are relevant to me as a basic assistant so I can go straight to that section? But I encourage you to still answer questions as far as possible without having to go to the reference source. So you need to prepare yourself ahead of time in terms of the information as well as how to use the reference source in an open book exam. And then do the same with your online reference sources. Okay, and you will have that practice opportunity, practice exam opportunity, and so you will be able to see during that time how you can use those online sources as well. We've got familiarize yourself with the website, South African Pharmacy Council. We've shown you how to find documents there, and then there's also the SAHPRA website, which has documentation there as well. Read your questions carefully. Okay, remember that last question, that question about where you had to do a second conversion. Okay, think, am I at the end of my question? The one with the labels. Okay, it didn't ask how many labels must I return, it said what percentage of labels. Read carefully. Okay. Identify the statements that you are sure of. So remember, a single best answer. You read the question and it gives you 4 options. You should be able to immediately eliminate one. Okay? Oh no, that's nonsense. No, that's not right. This one could be right. This one could be right. Now you've only got 2 statements that you are having to think about. Okay, so immediately eliminate those that you know are incorrect, and then consider the ones that you're unsure about. Okay. And then if you need to confirm, then you go to your reference source. You do not need to confirm every question with your reference source. Okay, don't think that an open book exam means that I must double check every question I answer with the reference source. You will never finish your exam that way. And if you can't complete the question, you can carry on, and then at the end of the exam, you can come back to the question if you need to. Okay. We are very careful in the way we word questions. We very seldom will use a negatively phrased question that says which of the following are incorrect. Okay. Or all of the following except. Because those are what we refer to as negatively phrased questions. However, if you do come across a question that is negatively phrased, it is looking for a false answer. Okay? Most of the questions you will come across will be which of the following is true, which of the following is correct. Okay, and then we are obviously always looking for the correct answer. And then you will also find questions that will talk about most of the questions where you'll say, oh, there's 2 answers here that could possibly be correct. Which one is the single best answer? Okay, so most appropriate implies that the second answer could be correct in a certain circumstance. Let me go back to my question. Reread your question. Make sure you've got the right context. Okay, in this context, which is the most appropriate? And then it should stand out to you, which is the most appropriate. And then managing your time. So You've got approximately, for your 84 questions, 168 minutes, 4 options per MCQ, and so in this case you've got about 2 minutes per question. For your calculations, you had just over 2.5 minutes. For your general questions, you have 2 minutes. But remember, it's all part of the same exam. So if you are very well prepared for your general section, and you're able to get to your general section simply quickly, more time then for your calculation questions. And remember, you can go back and answer questions. You don't have to sit and get stuck on a question. Move on, and then you can go back. Okay, and finish answering other questions that you may have missed out. Reminding you again, marking, so try your best not to leave anything blank. Right, that brings us to your general examples. Sam, can we please have that link copied into the chat or the Q&A so that the participants can access it or use the QR scan code, and then you will have 10 examples of general questions that you can attempt. I'm going to give you 10 minutes. That will take us to 11 o'clock.
Yeah. Questions.
Mhm.
Yeah, you're talking. Yeah. And you got married 5 days a week. Bro, can you imagine that? Imagine 5 days a week on the and it's just not my own fault. I was your own fault. And then, the all, come on, you don't want to. I don't want to say it. It's not good. I was yeah, same. Some sort of extreme.
I think there's about 2 minutes remaining.
Today, let's go. Oh,
Okay, let's get started. Just mindful of time. Right, so our first question here is maybe one of those questions that might have more than one correct answer, or you might think it has more than one correct answer. So it says, what is the most? Most is capitalized. That means it's important. Remember, we said sometimes if it says most appropriate or most correct, that there's possibility two answers that might be correct or could seem to be correct. What is the most correct term to use for stock that is at the end of its product life cycle and has not seen any sales or usage for a set period of time? Now, believe it or not, this is a straightforward knowledge question because it's a definition. Okay? And so some of you might have said it's called unusable stock. But unusable stock is not actually an official definition. We talk about obsolete stock. So obsolete stock in this case is the correct answer. It doesn't, there's nothing in the definition that implies that the stock is expired. Okay, so it's the end of its product life cycle. Not at the end of its date, or there's nothing referred to about a date in here at all. Okay. Right, the next question. Which of the following sectors is the first point of entry for patients seeking health services in the public sector? Now, again, it's a definition. If you go and look up the definition of primary healthcare is the first point of entry. Yes, in practice, many people do access a hospital first, but they really should only be accessing a hospital services in an emergency situation if they go through the emergency room. But the most correct answer here is that they should first be entering the healthcare system through primary healthcare and then being referred on to hospital if that is deemed necessary by the primary healthcare practitioner. Third question, which of the following medicines can a pharmacist assistant basic assist in the manufacturing of? So now this question is more applied, maybe requires a little bit of evaluation because you need to know what your scope of practice is. And you can see this is the type of question that you're not just going to find the answer in a textbook or in a reference source. Okay? This is the type of question about my scope of practice. What am I allowed to manufacture? Well, I know if I read my scope of practice says that I can only be involved in the manufacturing of non-sterile medicines. Okay, well, these medicines, which ones are then non-sterile? Is a suppository non-sterile? Yes. Is an eye drop non-sterile? No. On an eye drop, it will tell me that this is sterile. And as soon as I open the eye drop, then it's been compromised, the sterility. But in the manufacturing, eye drops are sterile. A subcutaneous injection, well, that's also sterile because that's something I'm injecting into myself. Yes, that is sterile. Total parenteral nutrition, also sterile. It is nutrition that goes directly into the patient's bloodstream. It is sterile. So the only correct answer here, there's not even ambiguity here. 3 of these are sterile, 1 of them is non-sterile. The only one that I can be involved in as a basic pharmacist assistant is a suppository. Which of the following tasks can a pharmacist assistant basic do in community pharmacy? In community pharmacy. Again, a question that is speaking to your scope of practice. Okay, so can a basic assistant capture stock onto the inventory system? Yes, of course they can. Can they update the Schedule 6 register? I'm very pleased to say that none of you showed that as your correct answer, which means you have a good understanding that you may not update the Schedule 6 register. Can you counsel a patient on how to take their medicine? Not as a basic assistant. No, you cannot explain to a patient how to take their medication. That is not within your scope of practice. And can you perform a blood Glucose screening test, let's see. Oh, 3% think that you can. You definitely cannot. You may not work with biological fluids. Okay? You have not been trained. It's not in your training within your scope to be able to do screening tests. Only correct answer here is 4. There's not even an ambiguous answer here. Okay, it's very straightforward. The capturing stock on a chain inventory system is the only task in this list of tasks that is within your scope of practice in a community pharmacy. Okay, another definition. What is a tablet that must first be dissolved in water before swallowing, known as? Okay, so you've been given 4 dosage forms. You have got to know the definition of each of those and apply your definition to the question. Okay, a buckle goes into the cheek, modified release, doesn't have to be dissolved in water, it's just got a special coating on it, or its formulation is a little bit different, but it's not one that is dissolved in water. Sublingual goes under the tongue, effervescent. You drop that like Carenza C or Barocca, one of those, goes into water, it fizzes. Once it's dissolved, then you drink it. Your ACC 200, those kinds of medicines that are dissolved in water first. So, another definition. Where is the site of administration for a dosage form that uses transdermal delivery? So you've got to know, okay, what is transdermal? Across the skin, transdermal, across the skin. And so the site of administration then is on the skin. And so you really just, nothing ambiguous here as well. Very clear, you need to know what transdermal is. And then when you apply a transdermal delivery system. Examples of transdermal, Transact patches, a lot of the estrogen patches also go onto the skin. Next question. If stock is received on the 3rd of July, 2025, that would be today. You are receiving stock today. With an expiration date of the 30th of December, so it's expiring at the end of the year, that is your new stock. But there is already stock on the shelf. And the stock on the shelf is only expiring at the end of January next year. Using FEFO, how should the stock be packed on the shelf? So you need to know what is FEFO. Okay, because there's different terms that we use. We use FEFO, FIFO. So what is FEFO? FEFO, first expiry, first out. So that means that the one with the earlier expiry date must be packed in the front of the shelf, which is unusual because normally you're receiving stock with a later expiry date is your newest stock. But in this case, your new stock has actually got an earlier expiry date. So you need to pack your current stock behind your new stock. And the only way to know that is to know what FEFO is. What does first expiry, first out mean? And how do I apply it in this question? Also, what is the most correct answer? So this person thought these people said, we'll take the easy route out and we'll just say new stock must be packed next to current stock. That isn't FEFO. That's not the principle of FEFO. Okay. Okay, and short-dated stock, it's 6 months, so it's not short-dated. Right, next one. Which of the following statements would apply to a tablet that is packed in an amber bottle? Okay, you need to know the application of why we use darkened containers in pharmacy. And darkened containers, this is a basic scientific principle. An amber bottle or a darkened container is because you're trying to protect in fact, amber is like a brown color, those brown bottles, that's what amber is. You're trying to protect it from light. Yes, all medicine containers need to protect, oh, there's a spelling mistake, I just saw immediately. all medicine containers need to protect your medicines, okay, from oxidation, humidity, light, sensitivity, but those that are plastic amber bottles are in particular because they are sensitive to light. And that's the reason it's in a darkened okay, here's a computer question. Which computer program is most suitable for writing a report or report writing? Some of you had said PowerPoint, some of you had said Excel. You might use a PowerPoint to present your report, but you're not going to use PowerPoint to write your report. You might also include some Excel spreadsheets in your report as addenda, especially if it's a financial report, but you wouldn't use Excel to write your report. And then Teams, we are busy on Teams now. It's the program that we use to be able to communicate with you and present to you online. It is not the most suitable for report writing. Okay, it's important. So your Word document or your Word document is your most appropriate one. And then your last question here, what reference source can be consulted if a pharmacist assistant basic is unsure of what the specified cleaning product is to use when cleaning equipment in a community pharmacy? Now, good pharmacy practice will definitely help us write the SOP, but good pharmacy practice does not necessarily specify specific cleaning products to be used for different scenarios. Okay, that for your community pharmacy will be in the SOP that is written in your community pharmacy. So yes, they would have used GPP as a guideline to write the SOP, but when they're specifying certain things, it is specified within the standard operating procedure. Okay. And that brings us to the end of the basic questions. I think we're going to have a Q&A now. I'm just going to check the Q&A. I don't take over at this point. Yes, thank you. Let me just go through them. There's a question around question 3. Is it question 3 on the general questions? That's which of the following medicines can a pharmacist assistant basic assist in the manufacturing of? This one. First, it refers to scope of practice. Scope of practice says that you, as a basic pharmacist assistant, may only be involved in non-sterile manufacturing. And if you look at the products you've been given here, eye drops, subcutaneous injections, as well as total parenteral nutrition are all, parenteral tells you that it is an IV intravenous line. And so those are all sterile. The only one that is non-sterile is a suppository. There's also a question to explain more on question 10. I think that might be on the calculation question. Let me quickly check. And I did put an explanation into the chat on that. Well, I put it in, I responded to the person, but I can put it into the chat. I don't know what the participants are able to see. So question 10, I'm going to work on another while the office is busy, and then I will present another example at the end of the workshop. Okay, there's one. The resources that we can bring into the exam, can we just bring the good pharmacy practice book only, or you have to bring all the resources that were listed. I think the office will clarify with you what will be available on the online system. But it really is your decision and your choice as to what resources you bring in with you. I think it's more important that you prepare ahead of time and then just bring in the resources you feel you might use during the exam. That was the only question for now. I'm going to stop sharing. Is the office going to take over now? Yes. Thank you, Papi. I'll take over from this. Thank you. Hey, thank you, Dr. Fogati. My name is Puselezo. I'm back again. I'm going to just take you through the process in terms of the pharmacy council side on how to write the exam. So I'll take you through the whole process. I believe in the last 2 hours, Dr. Fogati prepared you for the exam in terms of what to expect in terms of the format, the types of questions based on your scope of practice as a pharmacy assistant basic, and how to prepare for the exam. So I will take you through on how to prepare for the exam in terms of your computers and everything involved. So in terms of the eligibility criteria for the examination, there's 3 groups of people that can write this exam, the EISA for basic. So we have the first group, which is the pharmacy assistant, learner basic, currently registered under the new occupational certificate, so what we refer to as the new assistant course. The second group is those that were registered under the old qualification, which is the pharmacy assistant basic, and they have qualified and they intend to register for the new occupational certificate as a learner post basic. And the third group is those pharmacy students who are no longer enrolled as students, but have successfully completed their first year of study and they intend to register as a pharmacy assistant basic. So if you fall into the group of the pharmacy assistant learner basic under the occupational certificate, you've completed a minimum of 6 months of training with an accredited provider. In addition, you must have successfully completed the knowledge, practical, and work experience modules. You should have received a statement of results from your provider. And also completed a practice EISA before you can write for the exam and should have booked for the exam. In terms of the pharmacy assistant qualified, you should currently be registered as a qualified pharmacy assistant basic. You should have completed the practice EISA and also booked online for the exam. And in terms of the students, you should have registered as a learner basic, a former BPharm student, and have completed 400 hours in an approved pharmacy under the direct supervision of the pharmacist, submitted at least 1 progress report, completed the practice EISA and booked online. And I think it should be noted that you will not be able to write an EISA if you have not completed a practice exam, but we'll cover this as we go along with the presentation. So this is just the landing page. So if you log into the South African Pharmacy Council website and you log in, you will now move from the website itself into the secure site because this is now related to your own registration. So you will land on a dashboard, and when you land onto the dashboard, you'll see what is highlighted there. If you plan to book for an examination, whether it's a practice exam or it's the actual exam, the last block there which says EISA exam, you will click on it, and then you will see these 4 tabs after. So that will be examination, booking, results, practice exam, and the examination itself. So you need to click on the booking. So it's important to know that you will not be able to write an exam unless you have booked. but I will cover the timelines as we go along. So when you book the exam, Charlene is, or Dr. Fogat has covered this part. So there's two parts to the examination. You have the calculation side and you also have the general side. So when you do your booking, you have to book for both. Booking, it will say you're booking for it. You're also booking for a general and you will have to select the venue. I'm going to just take you to the venue option that you have. But when you book, this is how the screen will look. So you book for a calculation, you select the venue. You book for the general, you also select the venue. And you will see for the examination booking itself is 711, but I will tell you the different fees applicable to the booking. So once you have selected the option to book for calculation and general, you will see the amount just indicated. The examination fee is 711. Then if you're happy to go along and book, then you will click the book examination option, and then you'll be taken to the payment option. So if you have credit onto your account, you can use the credit, you can use your, or you can also use an alternative payment via the trusted internet banking facility. So those are indicated there. If payment is successful, the record will appear pending as you can see on the screen. So you see in front of the integrated examination, there is a pending option. So it shows that you have successfully made the payment, and once the office that payment, a case will be created and then it will be added onto the exam list. If a payment is declined, a communication will be sent to the candidate in the form of an SMS informing you of such. Now, moving to the preparation for the examination, most important is to first look at the dates for the exams for 2025. So we have 2 dates for this year, the 29th of July. This is a practice exam. As I mentioned when I started, that before you can write an exam, you should start by writing a practice exam. So this has been scheduled for the 29th of July, and then the actual exam then will be on the 23rd of September. These are the timelines. So today we're having the workshop. Tomorrow the bookings for the practice exam will open. The booking will close on the 21st of July. In this case, because it's a practice exam, there's no late bookings applicable. But in terms of the actual exam, bookings will open on the 11th of August. If you haven't made your booking by the 25th of August, that will close. So the 711, which I had mentioned before, that is the exam booking fee. If you don't book by the 25th of August, it means you will go through the late booking process, which will open on the 26th of August. But now, in this case, the fee will change. So if you miss the first part, you will still be able to book between the 26th of August and the 8th of September. However, the amount in this case will be 1,056 and 50 cents. What's important in this case is that you need to make sure that your details are updated on the SAPC profile, that you have the most current cell phone number on the system, as well as the email address and the profile picture. I will explain in terms of the profile picture how often you will need to update the profile picture in the upcoming slides. You are notified via email or an SMS of bookings, the opening and closing of bookings. You will receive information on your email or on your cell. Have any of these details updated, then you might miss important information. Now, moving to where you find the EISA manual and practice focus. I actually believe that all of us have gone to the website and we can navigate it. If you haven't, it's important that you do so before you go for the exam. This way you will know where to go and not waste time in terms of the logging in the actual exam. So if you go to the website, I'll also do a live demo. But if you go to the SAPC website, you type you can just say SATC, even on Google, it will take you to, this is the landing page of, you get to the landing page, you click on the registered person, and then under the registered person, you see the overview of practice CPD, application and assessment. You would click on assessment. So if you want to look at old or practice papers that you can use to prepare for the exam, they're here. So you can say there is a bullet there is you may download the practice performance assistant basic in Sapnika by clicking here. So if you click there, you should be able to access the program. And then in terms of the manual and the blueprint for the EISA, this is information that was covered during this session. If you want to go and refresh your memory or just look at more information, then you can access it under the manual. Is also on here. You can just click there to access the so to write the exam, so this is a remote examination, so you're able to write at any venue of your choosing. So you can choose the place or your place of residence. You can choose your workplace. You can come and write here at the SAPC office or any other venue of your choosing where you know that you will be able to write an exam. But it's important to know that even though it is a remote exam, the conditions of a normal exam will still apply. So wherever or the venue that you choose, basically any noise, you should be able to access the internet. The details will come up. So if you choose your place of residence, you will indicate as such. Workplace, this one is important that you discuss this with your manager or your IT department that you will be able to write the exam, because with other place or employers, they block some sites or they can block traffic or some sort. So you have to make sure that if you choose your workplace, the conditions will be conducive for you to be able to write the exam. So this remote examination is, as I've mentioned, it's like any other exam. If you wrote your grade 12, you wrote in a venue and it was quiet, the same will apply in this case. So you need to find a quite suitable place where you can write the exam. There should be enough space for the device and your reference material if you have printed and not using the online option. You should download the electronic reference material before the examination. I think this has been covered before. It just makes it easy for you to write the exam without now wasting time downloading reference material. You will need to keep calm, communicate with your remote invigilator should you experience any difficulty with the exam. You should ensure that you have the equipment needed, such as your calculator, paper for your working out your calculation, etc. And in terms of the device, this is the most important. You need to make sure that you have a device that works, and you also have connectivity. So in terms of the device that we suggest, you can use your computer, a laptop, or a tablet, but you cannot use a cell phone for writing the exam. So the device must have a camera or a linked camera with a video capability. Connectivity, the minimum should be 3G, and then you can only use the 3 browsers. So it can be a Google Chrome, Firefox, or Microsoft Edge. For those that are using Apple products, you can use Safari for the exam. So as mentioned, profile pictures, you need to make sure that the profile picture that is on the secure side, when you log on onto the SAPC website, it's not older than 6 months, and it should be a color image, and need to cover your head and shoulders. It's more like a professional photo. Please don't take the selfies as the profile picture. So these are the recommendation on what a profile picture should look like. This profile picture will be used by the invigilator to verify the identity at the time of the exam. So this is just an example of a profile picture which is acceptable. Okay, so where do you find the examination? This is applicable at the time of you writing the exam, whether it's a practice exam or the actual exam. you log on onto the SAPC website, click on the registered persons, and then click on the learner or student or trainee. And to access the examination, this is a screenshot that I will live demo what currently appears on the website. So if you go to the assessment, you'll see it will have external integrated summative assessment. The screenshot that was taken for the practice exam for the 4th of February 2025, but we have since changed the information to include now the upcoming exam for the 29th of July. So on the day of the examination, you will need to log in onto the SAPC website and enter your one-time PIN, which will be sent to your cell phone. Complete the declaration, which I will take you through, and read the examination rules that are applicable. And then at 9 o'clock, the examination will start, and you'll have a remote invigilator. So this is dependent if you're at home, or you're writing at SAPC, or you're writing at your place of work. All of you will have an invigilator, so the same rules will apply to everyone. So there is a live invigilation through a video streaming, and images are taken to verify the learner based on your profile picture and the pictures that will be taken live during the examination session. So your device should always be on because those are taken periodically throughout the exam. And then the exam will end at 12:30. So the same rules apply with any examination. Once the exam closes, then it means you will not have access to the questions anymore. So in terms of the examination platform, you logged in using your key number, ID number, and the password. So if you're not sure of these credentials, you need to make sure that you have them now before the exam to try to make sure that you don't waste any time now asking for a password on the day of the exam. Once you have entered your PIN number, ID number, your password, you will receive a one-time PIN, which is valid for 10 minutes. This is sent to your cell phone or in an email address that is on our register system. So as I said, you have to make sure that those details are updated before the exam. If you have changed your cell phone number, update now. So on the day of the exam, then the one-time PIN will be sent to your current number. There is something called the proctor. So this is just an invigilation done remotely. So these checks, once you have entered your one-time PIN, there will be checks to make sure that the proctor will work during the examination. And now after that, you will take into the declaration. So the declaration is just you declaring that you are the person writing the examination, as indicated on your booking, and everything is indicated on number 4. So we have there that I'm writing the examination in a suitable area with minimal anticipated destruction. I'm writing the examination at the place stipulated in my booking. I am not sitting next to or in close proximity to any other intern. In this case, it will be the pharmacy assistant writing the examination. I will not receive any form of assistance, and I will not communicate with any other person during the exam. After the declaration, then you will be able to start the exam. So the invigilator will indicate when the examination has started. So you will then click on start the exam. Then you have access to the questions. Throughout the examination, you will see it's indicated here time that is left. So if it's a 3-hour paper, you will see here that I still have 2 hours. If it's a 2 hours, so if this is live time, then you can assess as you answer your question how much time you still have left. Once you have completed answering your questions, then you can complete the exam. It's important to note that the exam is structured in a way that one pharmacy assistant will not have the same, you might all have the same questions, but they are randomized. So if my number 1 will not be your number 1, my number 1 might be your number 8. So all the questions are randomized. So even if you're sitting next to someone, you will not see the same questions at the same time. So once you are done with your examination, you will be able to submit the examination and then be taken to a survey. However, if by the time the exam ends, you are still writing, you automatically the exam will automatically close for you. But all the questions that you have submitted will be taken into consideration. So it doesn't mean that if you don't submit, then you lose all the work done. All the questions that have been answered and submitted will be accounted for. So as I said, once you have submitted your examination, then you will have access to the post-examination survey. So in terms of how to log in and access the examination platform on the SAPC website, step one is that you log in. So how do you log in? You don't go through the normal logging in as you do on daily basis. In this case, you will get you'll go to the you'll go to the website. Again, you go to registered persons tab and then select learner, select assessment, then that's where you will log in from. Alternatively, you can use a link. This is the link that you can use then to access the exam. This will be shared with everyone as well. So once you land on the login tab, so you will enter your PIN number, ID number, as well as your password. Remember, when you enter your PIN number, or you don't just enter a number, it's a P followed by the 5-digit number. Yes. Step 3, you will insert the OTP. So when you log in with your PIN number, ID number, your password, an OTP will be sent to you on SMS and email, and this is valid for 10 minutes. So should you have any struggle during the 10 minutes, you don't request for another OTP, use the one that you originally received, unless if the 10 minutes has elapsed, then you can communicate with your invigilator. Step 4, this is where the equipment check happens. You log in, you enter you will see the screen on your computer where it checks for the browser, that the webcam is there, the microphone. The reason why microphone should be on is to make sure that you work in a quiet environment. There's no talking or communicating during the exam. There'll also be a network check, the screen check. So if all this had been turns green, meaning that it's successful, then you will be able to the next step. But you can, you will have access to this presentation. You can always check the compatibility of your device to make sure that at the time when you write the exam, then you don't go through. So once the equipment check has been successfully, you'll be able to then click next to access the next page. This one is where we confirm your profile. So if the information is not pre-populated, you will enter the details yourself. So it could be your last name, your first name. Those are the mandatory fields, but if you have a middle name, you can always add that as well. Step 7, this is where the verification happens. So the verification of the profile picture that you have on your profile, you also take a photo so that we can compare what you look like today and what you look like within, like in the 6 months ago or whatever, but it should not be older than 6 months because a lot can happen in 6 months. So you will also need to scan the QR code. So if you're writing on your laptop, you use your cell phone to scan a QR code to connect the phone to the examination platform. So this gives us a better view of yourself in the examination room where you'll be writing the exam. So you click on the play button and record a short video of your room surroundings. Step 9, you will complete the examination declaration. So this is just to declare the following, that you're writing the examination at the place stipulated as a booking. So if you have selected the place of work, then it means you still writing there. Should anything happen, you need to communicate with us before the exam. You also declare that you're not sitting next to or in close proximity of any other candidate that is writing. You will not receive any assistance during the examination. You not communicate with anyone during the examination and so on. You only use the reference that are permitted for the examination. You'll not give assistance to any other person, etc. So I think that earlier there was a question on which reference materials. So the reference material that we covered, you can use those, but if you have any other that you want to download, you may, but you can't use Google in the middle of the exam to try and get answers from Google. So this is just the declaration before starting the examination, as I said. So you have to declare that. And then step 10, you will read through the examination instructions as indicated, and then only start the examination once the invigilator has indicated that you can start the examination, and that will be at 9 o'clock. Once you're done with the examination, you have answered all the questions and you are happy, then you will submit the examination and be taken through the survey. So this is just the 2 points that will appear before you submit your examination, that you confirm that you have completed the examination without assistance, and you understand that if it is found that you have contravened any of the examination code of conduct, SAPC will implement disciplinary action against you in terms of Chapter 5 of the Pharmacy Act. You will not or have not shared or retained the contents of the examination via electronic, printed, written or verbal means with any person. So important message to take note of. In the middle of the exam, you might get these kind of messages. So the first one is you have to make sure that you are in the same time zone. So some people might be writing outside of the borders of South Africa, so the time zone should reflect the time zone which we are in, which is Pretoria. And then the last proctoring, as I said, this is more the invigilation assistance for us. So if you're not connected to the system, you will not be able to continue the examination. So you will get this message, then you can connect through the QR code as mentioned before. And then if you try to start the examination and the invigilator hasn't indicated, you will get this error that you cannot start the examination until the invigilator has started the examination. And then when the examination started, then you will get the indication. So in terms of the format of the examination, there'll always be one question per page. You cannot select which question to answer first. So as I said, this is a randomized examination. So you don't choose which one to start with. So you will answer the questions as they present themselves to you. This is a timed examination. So if the examination started at 9, ends at 12:30, there's no additional time that will be allocated to candidates. You cannot revisit any question that has been answered. Only unanswered question may be revisited at the end of the examination. I think this was covered earlier by Dr. Fagati. So there's always a single best answer to the question. So you will get multiple choice question with 4 possible answers, but you always then have to go for the best answer. You might have closer options, but the one that is best then, or the most appropriate, will be the one considered. Okay, so as mentioned before, there are violations during the examination. You cannot use Google to access reference material during the examination. You have to make sure that all the reference material that you plan to use are downloaded before, because you can't use Google during the session. And any action undertaken by the candidate to gain any unfair academic advantage will be considered a violation. This may include, and this is not, the list is not limited. So if you're cheating or copying, possession of unauthorized material, that will be considered a violation. If for any reason there's conversation in the background, so you will get, or the invigilator will communicate if there's some background noise to make sure that the place is quiet, but if it continues throughout this conversation, that will be considered a violation. And even the positioning of your phone for the live proctoring, if it's not sitting in your right place, you will be notified so that the invigilator has access to yourself and your equipment throughout, or the room that you're writing in throughout the examination. Yes, as I said, this is not exhaustive, but you just have to make sure if there's anything or any question from the invigilator or any recommendation, you follow those so that they're not considered a violation. Okay, so we have just a few questions which are frequently asked by those that write the remote online exam. So the first one is, where can I get help? You have an option, a chat function, where you can type your question in the chat function and your invigilator will respond via that chat. But you also have the option to send a WhatsApp message to the invigilator. We have a WhatsApp line that you can make use of. You have to keep calm. Invigilator will respond to your message. So if you have sent me a message 5 minutes ago, don't send the same message again, because we're going through all the queries that are sent to us. So it doesn't necessarily mean that when you send a query, you will get to the response immediately. What if the invigilator needs to contact me? As I said, you have to make sure that the cell phone number that is captured on your profile is current and in use, because that's the one that will be used for communication. Make sure that your device is fully charged and get data so that the communication takes place. So it can be on WhatsApp or you can get a direct phone call. The invigilator may call or send you a message on the cell phone number you have provided on the website. So please update those details on the website. The next question is, what to do if you experience load shedding or loss of electricity? So these are just a suggestion. You have to make sure you keep calm. You don't want to be anxious and now not be able to continue the exam because of the anxiety. Check your load shedding schedule before time so that you can make an alternative plan. Alternate plan, sorry. Ensure that your laptop is always fully charged before the examination. Ensure that you have an alternative Wi-Fi connection if you're using a fiber connection. Also, if you're unable to find an alternative Wi-Fi connection, or if you need to be connected to power supply, please find an alternative place. Important to notify the invigilator via WhatsApp if you have such challenges. If you have load shedding in the middle of the exam, your work will still be saved. And what happens to the questions you have answered if you lose connection? All the questions that are submitted are saved. That is important. So you must keep calm. All those questions will be saved. When you log on again, you will only have to ask, or you only have to answer those questions that you haven't attempted or answered. The ones that you have answered will be saved automatically. The questions will be randomized and they may renumber, continue to answer the questions as they have been. What should I do if my invigilator notifies me to see my cell phone view during the examination? You can scan the QR code again to ensure that your smartphone is connected to the platform and positioned correctly. What should I, if I need to change the exam venue? So all the changes to booking venue are to be communicated by email to the office. So you can't just make the decision yourself to change without informing us. what should I do if disconnected and on logging back a pop-up message says this page was opened elsewhere? So you must close all the browsers, refresh, and log in again. Okay, so this is just important. Where you're going to the venue or where you're sitting is very important. Images are taken of the candidates throughout the examination. So if you are in the house, the positioning of your table shouldn't be in clear where things that you don't want other people to see. So if you're sitting in the lounge or even in your bedroom, just make sure that it's place that you are willing for us to see, not look that you wouldn't want us to see. Be sure that there's sufficient lighting at all times. For example, close curtains or blinds if sitting in front of the window, because that image appears blurrish or a bit dark. Test the lighting beforehand. Take a selfie of yourself as a test. Ensure that your camera is on. Dress appropriately. Images taken during the exam form part of your permanent record. So this is an exam. We will treat it as any other exam, so you must dress properly. If the invigilator cannot see the image taken, they will phone you to make sure that your cell phone is on all the time. When will you receive the results? Can you view your exam paper, or can my examination be remarked? The exam results will be released once the results have been analyzed and verified. So this may take some time, but you'll get communication in terms of when they will be released. You may apply for review your examination. So this is a formal process where you need to complete an application form and pay the applicable fee to review the results. You will be allowed to view the exam questions and the answers you have provided. The correct answer will be indicated. You may ask the facilitator for the reference or the steps to the calculation. You are permitted to make notes. However, you may not take a copy or photos of the examination itself. You may not apply for a remark. The results have been checked and verified. So after the exam, all the results are checked at different levels and verified before they're released. So by the time you get your results, you should be sure that everything is as it appears. And I think we are on 11:53. I'm not sure if there's any questions on the chat. Okay, while waiting for the team to assist with the question, this is the official email address that you can use to send us questions, or if you have queries related to the exam or the booking. IT, do you have any questions on the chat?
There aren't any questions for now. Mr. Mehta is answering them via the text, so participants should be able to see the responses to their questions.
I think Dr. Bogati was preparing or working on a question that was asked before. I don't know if you want to respond, Dr. Bogati, and you can take over if you're ready.
Okay. So I am going to, I don't have an electronic pen, but I'm going to do my best to draw an explanation for you so that you can understand how to work this out. Okay. So this is the question 10 that everyone is struggling with. And when we have an unknown, usually we give that unknown a value, and that value is x. Okay. So if we say that x is the mass of the cream that we need, we know that it's 20 grams per tube. Okay. But we're trying to work out now how many grams we're going to need for our total compounded cream, and then decide how many tubes we need. Okay, so X is the mass of the 20-gram tube, or X is the mass of the amount of cream we need to make up a 20% mass per mass volume. Our target concentration being that 20 grams, okay, mass per mass. And we looked at what does that mean. So what does that mean? That means, sorry, that should be a percent. Let me rub that out. That should be 20%. Yes, okay, it's 20%. Sorry, I'm using my mouse to draw. Okay, so 20% mass per mass is the same as saying 20 hopefully you said it means grams. What's going on here? Okay. 20 grams. I think I'm drawing a circle. Well. Oops. Okay, it means 20 grams of active cream in 100 grams of your total compounded cream. Okay, that's what this is asking for. 20% mass per mass is 20% is 20 grams of active in 100 grams. Now, you were told that you've got a 20 gram cream of tube and you're going to add that to 80 grams of aqueous cream. So if I say 20 plus 80, I'm also going to end up with 100 grams, right? Okay. And so because my active ingredient is 20 and I only need 20 grams, that means 20 divided by 20, I need one tube. Okay, you need 20 grams of active. You've got 20 gram tubes available, and so you need one tube. And the reason is because this is mass per mass, 20 grams in 100 grams, and your final compounded volume is also 100 grams, 20 plus 80. And so you've got a 20 gram tube, you only need 20 grams in 100 grams, and so 20 divided by 20 equals 1. There's another question that is different, but similar, also working with weight per volume. This is asking for how much volume. So how many milliliters of a 2% weight per volume solution can be made from 10 grams of solute. So what does 2% mean? 2% weight per volume means I'm giving you a chance to think. Is it grams or milligrams? It's grams. It's a percent, 100 moles, 100. And what is your volume? It's moles, not liters. Moles. Grams in 100 moles. So you've got a solution of 2% weight per volume. That's 2 grams in 100 moles. Okay. When we're trying to work out an unknown, in this case, we're going to use X as well. Okay, so we're going to set up a proportion. 2% means 2 grams in every 100 mole solution. We want to know how many milliliters of that solution can be made from 10 grams of solute. So if we have 2 grams in 100 moles, okay, we can write it as A, then how many moles will we need in or 10 grams. Okay. And then we solve for x. And how do you solve for x? You do a cross multiplication. You end up with 2x equals 100 times 10 is 1,000. Now to get to x, I need to divide both sides by 2, which means I'm going to divide there by 2, and what I do to one side, I must do to the other side, and that means I'm going to end up with 500 moles. So that means I can make a 500 mole solution from 10 grams of solute. Another similar question, other way around, how many grams of solute are needed to prepare a 250 ml of a 5% weight per volume solution? So again, if I've got 5% mass per volume or weight per volume, what does that mean? It means 5 grams in how many moles? It's a percent, always 100 moles. Okay, now I'll set up my proportions. So if I've got 5 grams over 100 moles equals x over how much? 250 moles. So now in this case, I know what my moles are. I don't know what my weight is. I know what my volume is. I don't know what my weight is. So x now becomes my weight. Again, we do cross multiplication. We have 5 times 250 is 125. O equals 100x. Now to get rid of the 100, I need to divide both sides by 100. Okay, now how's an easy way to do this without a calculator? If I've got 1250, okay, and I've had to divide it by 100, my decimal place would be here, right? At the end. But now I'm dividing by 100, so I need to go backwards by 2 zeros. 1, 2. So I put my decimal place here, and that means your answer is 12.5. You see the decimal, this is a decimal. No one told me you can't see the screen. Sorry. Okay, so yeah, again, let me go through this one because the screen wasn't on view. I was drawing on my other screen. So 5% weight per volume is 5 grams in 100 mils. And so we change that into a proportion to solve for x. So it means I've got 5 over 100, 5 in 100 equals x, the unknown. The unknown is the mass over 250. I know the 250, it's there. So that means I must cross multiply. So 250 times 5 is 1250 equals 100 times x is 100x. To get rid of the 100 on each side, I must divide both sides by the same value by 100, which is then means I'm going to end up with x, and then divide by 100. So I move my decimal places 2 spaces, and my decimal goes, and it becomes 12.5 grams. Okay, office, I'm done with my explanation. Thank you. I just want to just do a live, just to go more. Sorry, you quite right. I haven't done the knowledge hub. Let's do that. Can I take over, Dr. Kawati? Just to live demo on how to access the website, whether to access the manual and the practice paper or to access the website at the time of the exam.
Someone from the office taking over?
Please confirm if you can hear me. Yes, I've taken over the supervisor.
Sorry, Divya, I don't know why I couldn't hear.
You can hear me now. Okay,
I can hear you.
yeah. Them on how to access the SAPC website. So you can either type council.co.za or you can just go to Google and type the SAPC website. When you click to the SAPC, this is the landing page where you can access all the information. But in your case, you have to click on the registered person. So you have the tab about SAPC. The next one is registered persons. You click on it. And once you click on it, these are the options that you get, but you only click on the one that says learner or student or trainee. This is just the overview of learners, scope of practice, CPD, any applications that you will click on the assessment. If you click on the assessment, you have the option to click on the EISA. This is the practice one that will take place on the 29th of July, so currently it's not open. But on the day of the practice exam, this is where you will click. You also have access then to download tutorials related to the EISA. Video is here, and you also have a step-by-step on YouTube. And to access the manual is right at the bottom here. So you have practice papers here. You can access them from here. And then the manuals, manual and blueprint you can access from here. Okay, and I've seen these questions that keep repeating themselves in terms of the practice exam. There's no booking fee applicable for the practice exam, so you won't have to pay that 711 if you're writing the practice exam. Other questions were related to when do you pay? You pay when you make the application, you don't pay after you've written the exam. And the option of writing at the SAPC offices, you don't have to bring your device. The only thing you need to bring is your phone, but you don't need to bring your laptop unless if you prefer to write on your laptop. But we have laptops available for anyone who chooses to use SAPC as a venue. There were also questions relating to whether you can use ChatGPT. Any AI cannot be used the way I said you can't use Google answers. You need to refer to material or reference material for answers, not ask ChatGPT for that. And your phone should be on throughout the exam. If at any point your phone is not on, so it means the proctoring will be off and your access to the exam will be terminated until you're back on. I think that was about it from my side, unless if the team wants to address any other matter. Thank you.
So with regards to the remaining questions on the chat, since we are almost done, we do them live.
Okay, is this the one that says new, right?
Yeah, the none of the new from the published. Which is a few that we haven't gotten through, I can read them out.
Oh,
Which is on. So there's one that came in relation to the each. That's the first thing I was going to write the explanation on the ECPC website, and the answer to that is yes. The next one is if you only register as a PhD in a specific sector, so you still have to write the EISA, yes, and that EISA will be still assessed on all the sectors. The next one is, are we able to register with our cell phones or do we need to do it with our laptop? So the actual exam is written on a laptop or a desktop. The cell phone is a second device that you need for the purpose of invigilation. So for the day of the exam, you need both. Can I please put the devices to use for the exam are 1, you need your cell phone for the invigilation. 2, you need a desktop or a laptop for the sake of the writing. And we need to make sure that both of them are camera compatible and they have enough data for the test. Is the booking fee for practice no, only for the actual exam? We bring past papers as references. No, we don't bring past papers. We need to notify facilities that are available from academy where we could write. And will it be on paper as an assistant with your cell phone? So we do not have facilities that are currently listed. We can, however, communicate with your provider or your workplace for you to be able to write on the day. None of the exams are physical or on paper. All of them are online. So regardless of your examination venue, you will still be writing the examination online and you will still need your cell phone for invigilation. Next one, I am finishing my post-basic this month. Is this examination compulsory for me? No. You will write the post-basic EISA when the time, when that examination is available for you to be able to qualify for the PT. I missed the part about moving to the next question and then returning to the previous question. Are you permitted to move to the next question and return for restating purposes or attempting the question again? No. If you want to return to a question, you must answer it. Once a question has been answered, you will not be able to return to it. When do you pay this 711? Is it before the EISA or after? You need to pay this fee at the point of booking. If the fee is not reflecting on our side, you will not be able to write the exam. So you pay the fee at the point of booking and then you provide us with the proof of payment. So we can apply for an intake. We won't have to write the EISA first. Yes, we need to be able to move on to the next stage of your training, which is the post-basic. You need to have written and pass the EISA before you can be registered. The only differences are they permitted to be on your phone in the accessible during the exam? No. They need to be accessible on the laptop that is on the shared screen, not on your cell phone. Once you are starting to write the exam, once you are in the exam, your cell phone is literally standing next to you for the purposes of sharing a live video feed to us. You cannot access it for WhatsApp, you cannot access it for calls, and you cannot access it for references. All your references must be downloaded and readily available on your actual laptop. Or if you're going to them online, they must also be on your laptop and not on your cell phone. The next one is in our last assessment module of August for basic. We're still going to be able to register. If you do not write the practice exam now at the end of July, you will be eligible to write the next set of EISA. However, on the website there are dates for the next set of practice EISA and the actual examination. So if for some reason you do not have your results, from your provider, and you're not able to write the practice EISA on the 20th of July, meaning that you're not going to be able to write the exam on the 23rd of September, you will have another opportunity on the 14th of October for the practice and the actual exam on the 2nd of December. The amount 711 is payable for practice, no, just for the actual exam. Can you give us a formula or simple step-by-step to do this? I am not sure what this refers to. However, if it is accessing the exam, that has been done. If it is accessing the presentation and the certificate available on the website as well for you to review data. When you register for the EISA, when the bookings are open, communication will be sent out with the step-by-step approach on how to do it. Does this mean we must not use input products at all or use a different search engine? If your input product is able to host any of the three provided search engines, which is Firefox, Google Chrome, and Microsoft Edge, you can do so. However, what we are saying is we have been conducting this exam for a while, and we've experienced that with most input products do not take other search engines and prefer Safari. It is quite difficult for you to access the exam without any technical issues. We will be able to register for the exam as of tomorrow. Once the bookings are open, we will send out communication. Another one for the post-basic, we've already answered this. Dr. Fogati said that they'll post a link for the Knowledge Hub method. Dr. Fogati, I guess it's a reminder for you to please post that link with regards to the Knowledge Hub. If we aren't allowed to use Google for preparing for the exam, are we then only allowed to use SAPC or SAPRA? So what we say with Google, right, is that you can use Google as a search engine for you to get to the SAPC website or SAPRA or any other website for that matter. But what you're not allowed to do is type in a question on Google for it to give you search reference options or for it to give you an answer. So you're not allowed to go, say you want to go to the GPP, you can go to the GPP online using Google, but you cannot type paracetamol on Google for it to give you answer options. I hope that helps. What material do we need if we are writing at the SAPC? So you bring all your preferred hard copy reference material, and you can have your online references as well as any memory stick or however for you to then be able to access. So you can have them emailed to yourself and access them by emails as an electronic copy. Can you guys please share with us the link to go and book for the exam and the actual exam? Once the time is that will be done. Can you book for the exam today? We will send communication. Don't you get the invigilator WhatsApp number so that we need them during the examination? The invigilator will contact you themselves on the day of the examination. They will also contact you by the chat function within the examination, and then we have that WhatsApp group and the email address that you can use to contact us prior to really accessing the exam or in preparation for the exam. So the practice data is on the 29th. Can I come to practice the SAPC offices? Yes, you're not allowed. Are we going to be able to register as Vienna Post Basic while waiting for the actual exam? No, we need the results to register. Please share search engines allowed. As Safari is not allowed. We said it's Google Chrome, Microsoft Edge, and Firefox. What is the 3 months course leading up to the final exam? The course of 450. I am not sure what 3 months course leading up to the final exam this is. Guys, the person could please elaborate. And if I don't have a smartphone and I'm disqualified, unfortunately, yes, you need to have a phone that will be able to allow you to scan the QR code and have a camera for the live feed. If I choose to write the SAPC, how then do I submit the material before the date of the exam? You can put it in the memory space. And if one doesn't have a cell phone, unfortunately, you need a smartphone for the day of the examination. What would be the rules to be if we are three writing in the same venue? The same rules will apply. You have to separate yourself and have enough room on the day of the examination. You will need to communicate this with the invigilator. Remember, before you start to take a video of your surroundings, so we'll examine that to see if you are meeting the requirements and communicate. So, when you use uploading material from SBS Academy as references, yes. When do we actually pay on the day of the booking for the exam exam? That's when you pay the 711. Can one use the iPad for source material, not on the exam? No. You can only use material on the actual laptop. Do you need to register for the practice exam? Yes. When the bookings happen, will be notified. If the phone will be solely for invigilation, how then are we going to contact the invigilator on the chat function on the actual examination platform? Unless you are experiencing challenges with that, then you can try use your cell phone. I have already paid 7 months fee, so when do you need to pay at once? No. If there is positive balance on your account, that positive balance can be used towards your exam. Are we allowed to have hard copies? Yes. I would like clarity with regards to the part of connecting your cell phone to the proctor. Please re-look at the presentation and the video. If you are disconnected during the examination platform, your invigilator will also be able to assist you in reconnecting. However, there's a tab at the bottom of the screen that you can click on and have the QR code displayed again. I would like clarity with regard to the part of connecting your cell phone just into that one. Did you say there will be another exam this year of those years, the data on the website for the next upcoming board practice in the EISA? The last one has also been that I believe those are the ones that are published. You can see the new one. What do you mean by statement of results by the provider? We need our results from EISA Academy. Yes, you need to have completed all the things with your provider before you can book for the actual EISA. So you can't write the EISA if you haven't completed your screening with your provider. And allowed to use the bathroom whilst writing is just to identify your invigilator so that they're not looking for you when they're not seeing you from the screen. Then another basic who has completed exam but has not yet gotten a certificate and are able to write the EISA exam in July. The practice you can book for it, and then the actual exam you need to have received your statement of results from your provider. When I write the practice exam on my phone, no. When you use hard process references, yes. If you don't listen, if you are code, what should you do? You will not be able to proceed in writing the exam. You need to go back at the camera and question QR code. The process is confusing. Please re-look at the presentation and the slides, and if the process is still confusing, you can definitely go to it with like in. I believe we are at the point. Anything else is on. Thank you very much for taking the over.
Thank you, Dispatch. So what is on the screen now is the survey. If you can scan, I can confirm IT if this has been of communication if this has been posted on the chat as well. So you can either use the link to access the survey or scan the link that's currently on the screen to access. I think from our side, all questions have been addressed, but should you have any other question after this, you can make use of the email address that was shown, or you can access the presentation on the website as well if you want to just refresh. Yes. So this is you can use this WhatsApp, or you can send us an email on the email address that will appear on the slides. From our side and the team from communication and Dr. Bugatti, I think we are done. Thank you so much for making time.